So today we had the opportunity to discuss motivational interviewing for the busy clinician. We discussed the spirit of motivational interviewing, that it was comprised of 4 key concepts. 1, evocation, that the ideas come from the patient, not the provider. 2, collaboration, the importance of avoiding the expert role. 3, autonomy, the importance of respecting the patient's right to change or not to change. And lastly, compassion, that everything needs to be done with the patient's best interest in mind. We've also had the opportunity to discuss brief action planning, and I introduced you to brief action planning as a series of 3 questions and 5 skills that can be used to help patients set patient-centered goals for health. And I'm sure that many of you are thinking that this is all very interesting, but in reality, you're not seeing how that you could apply this into your workflow. And I understand exactly where you're coming from that. I'm an internist. I have a very busy practice. And I also, when I first was introduced to motivational interviewing, felt that this just takes too much time. It's great that it works, but I just can't be doing this during a busy office setting. So I thought it would be interesting today if I shared with you my own personal experience with this and what made me change my mind to see that I don't have the time not to do this, because it really does work. So let me introduce you to a patient of mine. This is a real patient. His name's Mr. Smith. I know him for many years. He's a 63-year-old heavy smoker, and he has psoriatic arthritis. He has a very sarcastic personality, and we have this very friendly relationship for over 15 years. We bicker and banter when he comes into the office, and I really enjoy seeing him and taking care of him. We discuss smoking at every visit. Now, that's a lot of visits. I know him for 15 years. I see him about 3 times a year. And at every visit, he is never ready to quit. There's a lot of wasted time discussing smoking and just not getting anywhere with him. And it's gotten to the point that when he walks into my office, he puts his hands up in front of his head and he says, "Hey, doc, let's not go there today, okay? Let's just not go there." So he doesn't want to discuss his smoking anymore when he comes in. So I wanted to share with you the evolution, the history, the 15 years of history of my discussions with Mr. Smith around his smoking. So here I am, right out of residency and very enthusiastic about starting a new job. And I saw Mr. Smith. He's one of the first patients I took care of. And I said to him, "Mr. Smith, I'm concerned about your health." And Mr. Smith responded to me, "Well, don't be. I'm not, and I feel good." And I want to let you know that these are kind of almost exactly the words that come out of Mr. Smith's mouth over the course of the 15 years that I've been taking care of him. This is really a true story. I said to him, "Well, your breathing would be better." I gave him some reasons why he should consider stopping smoking. And he said to me, "Well, I'm not complaining, doctor. It's really not an issue for me." I asked him, "Well, what does your wife think about your smoking?" And he said to me, "I smoke outside and it doesn't bother her." So I really was not getting anywhere. Now, Mr. Smith has always had financial concerns, so I brought up the money and I said, "Well, Mr. Smith, what about the money? Cigarettes cost a lot of money." And he said to me, "Well, doc, my wife's family sends them to me cheap from Ecuador, so it's really not a problem." So then I resorted to scare tactics. "Mr. Smith, what about cancer?" "No cancer in my family, doc." "Mr. Smith, you could die." "Doc, when it's time, it's time." So then I had an idea. Why don't I tell Mr. Smith how to do this? "Why don't you just cut down by a few?" I said. And Mr. Smith said, "Why?" And I thought to myself, because I don't want to have to tell you, "I told you so" in the future. So I tried something new. "Mr. Smith, only you have the power to make this change. And when you're ready, I can help you." And Mr. Smith said, "Doc, I'm not ready." So I resorted to guilt. "Mr. Smith, I wouldn't be a good doctor if I didn't discuss your smoking with you." Doc, I know it's your job to speak about it. You're a great doctor even if you don't. I'm just a bad patient. Hey, I have an idea. Why don't you just mark down that you did, but don't? Oy vey, this isn't working. So then I had the opportunity to attend a wonderful workshop on motivational interviewing in Albuquerque, New Mexico. And it was taught by Bill Miller and Terry Moyers. I learned so much, and I came back so enthusiastic to try what I had learned on my patients. And guess who came into my office that first week? Mr. Smith. Hello, Mr. Smith. How's it going today? And Mr. Smith put both hands up in front of his face and said, Hey, Doc, let's not go there today, okay? Okay. I respect the fact that you're not interested in quitting, so I won't bring up your smoking today, Mr. Smith. And Mr. Smith breathed a sigh of relief. He leaned back, and I watched his body relax. Mr. Smith, would it be okay if I ask you one question? Sure, Doc. Anything, he said. I know that you don't want to, but if you did stop smoking, how might your life be different? I asked. And Mr. Smith chuckled and he said, I see where you're going, Doc. I see where you're going. But he answered my question. Well, if I did stop smoking, my wife wouldn't be on my case all the time. I wouldn't be so short of cash, and my breathing would be better, he said. So there's the change talk. And the reasons for change are all coming from Mr. Smith. And then he said, Hey, I really could cut down a little bit. It wouldn't be so hard. I don't want to end up like that guy on TV that breathes through that thing in his neck. Mobilizing change talk and more reasons for change. So then I said, you recognize that there are many benefits of stopping that would improve the quality of your life. And it sounds like cutting down a bit is something you feel confident that you would be able to do. Would you like to make a specific plan around this for the next week or two? And that's the first question of brief action planning. And Mr. Smith was interested in making a brief action plan. The ideas for his plan came from Mr. Smith. It was a SMART plan, specific, measurable, achievable, relevant, and timed. He had a high confidence level, greater than 7, that he'd be able to achieve his plan. And for accountability, Mr. Smith agreed to follow up with me in a week. So I'm sure many of you are thinking at this point that this is an interesting story and that perhaps motivational interviewing works. But it takes time, and you're right, having conversations with patients about change does take time. But motivational interviewing works. Remember, I worked with Mr. Smith for 15 years talking about his smoking. And none of the strategies that I employed during that time ever worked. 15 years, 3 times a year. Now that's a lot of wasted time. So what I've learned from my experience with Mr. Smith is that I really don't have the time not to use motivational interviewing when I talk to my patients about behavior change. And I really believe, because it's such an effective strategy, that it's a good use of my time. So let me share with you some follow-up about Mr. Smith. Mr. Smith still smokes, but he's cut down dramatically. He had success with his first brief action plan, and that success increased his self-efficacy to make additional plans around his smoking at future visits. Now when Mr. Smith comes to my office, I don't always ask him about his smoking. And when I don't ask, he'll often ask me. He'll say something like, You're going to ask me about my smoking today, aren't you? And I respond, Only if you want to discuss it, Mr. Smith. Thank you so much for your time today. I hope that listening to my story about Mr. Smith and my experiences applying brief action planning and motivational interviewing to a busy clinical practice setting inspires you to go out and learn more about these skills, and that you'll have as much success as I have applying them to your clinical practice. Thank you so much for your time.